health experts now recognizing the fourth trimester. Dr. Richard Chaffoo is here to explain more because we know the first trimester, second, third, but fourth?
Fourth is so important, Shally, because that's the period of time postpartum that you have in that first 12-week period that there's so many changes that are going on at that time. Obviously, you know, for a new mom, there's hormonal changes, you have a new baby, there's the sleep deprivation. So a lot of health issues come to play at that time.
As many know here on the show, I had 3 babies of my own. I was very well taken care of the first trimester, the second trimester, I had my babies. And then after I had my babies, all of a sudden it was poof.
Exactly.
And I started feeling sad and I couldn't get things together. And then there weren't a lot of resources around me to help.
Exactly, and this is why, Shally, the American College of Obstetrics and Gynecology have weighed in on this issue, of course, as the experts as they are, and have said that, you know, if you look at studies, unfortunately, at the present time, women have their first visit at 6 weeks following the delivery of their child. Well, 40% of women, which is nearly half of women, don't even make that appointment. In that one appointment, how can we really address all the health care concerns for the child, the mom, and the family?
We've talked about it here on the morning news, how much sleep and that period of time after you had your child is even pushing women into postpartum depression. They're finding that out now.
They are, and that's a great point. I mean, there's a sleep deprivation, the stress associated with a new mom and the breastfeeding, the health concerns, you know, the weight of the baby, and then overall, if there's any underlying medical conditions that the mom has, making sure that those are continually addressed. We really want to deal with this issue of postpartum depression, which can be devastating for a woman. And the obstetricians feel that we need to start the intervention early, that starting at that 6-week period, if half women don't even show up for those appointments, can cause significant health issues.
Why do you think it hasn't been a focus, Dr. Chaffoo, in the past?
I think it's not been a focus because we've been so focused on the newborn. And of course we need to focus on the newborn, and we haven't spent enough time and resources really identifying that the problems that we see in healthcare can oftentimes be prevented by preventative care starting early enough. You know, early intervention is the whole issue right here. And I think ACOG has come out with these policy statements because the important thing is that we need to look at a holistic approach for women, and it needs to be more family focused.
What are they recommending? So you
they
have
do
your
recommend,
baby,
yes.
Then what?
Then you want to be seen at 3 weeks. And at that 3-week period of time is when we begin to look for issues, look for, as you said, signs of postpartum depression, make sure the baby is gaining proper weight, helping the mom, supporting her with breastfeeding if that's an option, looking at any underlying health concerns that may be going on with the mother, you know, underlying health problems that could have been caused either as a result of the pregnancy or health problems that she had prior to that pregnancy, and make sure that those are getting addressed as well.
And some of these health problems, I mean, I found out there was like stuff going on with my muscles that I had no idea that it was happening until I had to go forward and take initiative myself to find out what was going on.
And I think that's the key for, you know, we have to, you know, women have to be their own advocates. And I think that now we're seeing that it's not just focusing on the baby, but focusing on the family overall.
And the mama, because she needs the focusing.
Absolutely.
Dr. Chaffoo, thank you for being here.
Sure, good to see you.
All right.